Hello, everyone. I'm John Lynn, the founder and chief editor at Healthcare IT Today, and I'm excited to bring a really interesting discussion around patterns of patients and how they're reacting to COVID-19 and the impact that's having on healthcare. And we're here with Sarah Bennight. She's the director of marketing at Stericycle Communication Solutions. Welcome, Sarah.
Hi, John. Thanks for having me. Happy to be here today.
Yeah, so before we begin, tell us a little bit about yourself and Stericycle.
Sure. My name is Sarah. I'm, as John said, the Director of Marketing at Stericycle Communication Solutions. And I've been in healthcare IT for about 12 or so years across various companies, some on the back end of the EHR integration companies, and then now on the more patient-facing technology side with Stericycle across product functions and marketing functions. Stericycle is a really large company. Most of you probably know us as the medical waste company, protecting what matters and picking up sharps, containers, and other medical waste and disposing of it in a regulated manner. But Stericycle Communication Solutions is a smaller division of Stericycle, and we offer patient engagement solutions. We're one of the only providers in the industry that we offer both technology side as well as the live voice side, which the human element continues to be very important in healthcare. And so we use both live voice and digital channels to provide the modern experience healthcares want, but also solving some complex challenges. Sometimes it's with more of our live voice solutions to patient access, action, and adherence.
Yeah, and that's why I thought this interview would be good is you have your hands directly in the patient, whether it's your live voice, whether it's your reminders, whether it's your self-scheduling. You really have an interesting view on the patients and how they're reacting to COVID-19. So what are some of the patterns you're seeing with your customers, and with their patients during COVID-19?
That's a really interesting question. If you look back 6 months ago, one of the first things we saw is when people didn't really understand what was going on with COVID, how it was going to impact the industry, what they needed to do about visits and elective procedures, just everything started cascading and shutting down. The very first reaction we saw was for providers to really just stop the communication. And what that created was another side to the patient fear. Not only were they afraid of coronavirus and what the implications were, but then now they're not being communicated with. Do I have my visit next week? Is this one of the ones I'm hearing on the news that's canceled? Is it going to be a telehealth visit? Like, what are these expectations that I have now as a patient? So we saw that in the early stages of the pandemic. Now we're seeing some hesitation to come back, but more people are engaging with the health system. I think there are a few healthcare companies or healthcare systems that are doing it really well, where they're talking to patients about how to keep them safe. They're offering different solutions as like virtual waiting rooms and telehealth options, so they can still engage with their care. They can still manage their disease and their disease progression, get the medications they need, get their refills, but staying safe. But overall, there's still a very large reluctance. And in fact, I was having a conversation with someone last week, and this floored me. And they said, flu season's coming up. And we now have COVID and flu season, which is an even bigger. I actually heard the word twindemic today. Flu and pandemic. I thought that was pretty clever. But that the anxiety that instills in patients now looking at two major respiratory illnesses, staring them in the face. This person told me, I will not go get a flu shot at my healthcare provider. I'm already at Target. I'm just going to do it at Target. It seems safer. And to me, that shows a lot about where patients' heads are right now. When it is safer for you to go into a grocery store to get a flu shot rather than your healthcare provider, that tells me there is either a lack of understanding or knowledge, or there's a lack of communication from the provider explaining on, here's what we're doing to keep you safe. And yes, it's absolutely safe for you to come get a flu shot because here are the protective measures we have in place.
Yeah, I mean, I think that's more of a perception problem than it is a realistic. But we have to go get food, so I think that must be where their perspective's coming from. I don't have to go to my doctor in
Exactly.
many cases, so it certainly skews their view. But you're right, it is a really about communication, and that's interesting. So the reluctance is from patients, I assume, to come back into the office. I assume most providers are ready for them to come back to the office and they're reopening. Are you seeing that, or is it more an embrace of telehealth?
Well, it depends on the area you're in. There are certain areas that opened really quickly. I'm here in Texas, and we opened very quickly. And then as soon as we got to 75%, the virus spike started coming up, and so they closed down elective surgeries again. So in some instances, providers are having to open and then close, and then are we going to open? They're kind of waiting for their governor to give the green light and say it's okay. I think right now we're in a position where most places are ready and accepting elective procedures. They're ready to do the flu shots, and I've seen providers go to great lengths to make sure their patients are safe. Like, for example, a pediatrician is sectioning off their office so one side only sees well patients, one side only sees sick patients who might have COVID symptoms or flu symptoms. And the providers that service those sides of the building they don't change. You're either on the well side or you're on the sick side. They wash it down in between the day, between the morning and the evening, and then they rotate the staff every week. The challenge there is, are you letting the patients know what you're doing? Because if I can say, maybe I shouldn't go into Target and get my flu shot, maybe I can just go in the back door and have a nurse visit, and maybe they can even, I don't know if this is even a thing, but maybe they could just come out to my car and give me the
Yeah.
flu shot right there. Would patients be more open to that? I'm not sure, but we are seeing people open more. We are seeing them open up their schedules more, turn back on their online scheduling, using online scheduling for even more than they ever had before, because another trend we saw, and this shouldn't be of any surprise to anybody, when the pandemic started, the way retailers stayed in business was a touchless experience. And that's what healthcare consumers are looking for. That's where the hesitation is can I do everything and not touch a surface? Can I have as little people come into this room as possible? Maybe I don't go through the check-in process with registration. Maybe I go straight to the room. I check in on my phone. I pay for my visit on my phone, and then maybe I see the doctor at a social distance with a mask on, and then I check out from my phone and you guys send me a bill. So this touchless experience that happened in retail is very much something that patients are wanting. And it's kind of funny, when I started at Stericycle in 2016, we used this stat that said, I think it was from Accenture, and they said in 2019, 77% of all visits will be scheduled online. Well, we haven't seen that, right? But I think that this pandemic is going to really open up the possibility of how digital tools can help you interact with your doctor, help get you the care you need, remote patient monitoring and everything that goes into that. And then also, gosh, telehealth is exploding. So even though people are opening, they are having to do it a little bit differently than they used to.
Yeah, it reminds me of something we talked about in the EHR world is how does that impact a patient? Does a patient care if they use an EHR? And the argument was often, well, if you're not using the EHR, what else aren't you keeping up on? And it wasn't necessarily a fair comparison, because certainly you could be a great medical doctor on the latest trends and treatments and not use an EHR, but there was this perception, going back to where you started, right? The patient perception that, hey, if you don't have online self-scheduling, where else aren't you doing it? And where else aren't you taking into account my needs to be able to avoid COVID-19? There's this perception problem for patients if they go and say, wait, the only way to schedule is with a phone call. So does that mean when I show up, I'm going to have to fill out some paper forms, which are a COVID-19 risk as well? I mean, so, patient perception definitely gets influenced when we don't communicate those things. It's interesting. Yeah, go ahead.
Well, I was going to say absolutely. And if you think about a big healthcare facility that's been closed to elective procedures suddenly opening up, I mean, imagine what's going to happen with our phone lines. All
Mhm.
those people that are in queue that had their appointments canceled, well, hopefully, the hope is that if the patient's taking care of themselves, that they're going to pick up the phone and call and say, I need to get back in, I need to reschedule, what do I need to do? So now if you're not offering that other avenue of scheduling, digital self-scheduling, or some other type of scheduling through the patient portal, you're going to be waiting. And how long are they going to wait? Like, have you staffed to be able to handle the reopening and the volume? So, that's what's really nice about Stericycle is having multiple agents that can be flexible to handle these volume increases and spikes and calls and needs to schedule. But that digital self-scheduling handles everything after hours when you're not there. I mean, think about the patients that you could get back into the system if they could schedule after work when they couldn't be
Sure.
on a phone call, or if they could schedule on their lunch break really quickly from their cell phone.
Yeah. Well, and you're right. If I have to wait on hold for a half hour to schedule the appointment, I'm going to have all sorts of perception issues as a patient as well. But I think to your point, that's the other interesting part of this. You talked about a lot of people delaying care, whether it was by their own choice or whether it was because elective procedures weren't allowed. So, what do you think some of the costs of the delay are going to be? And I would also bring another perspective on this and ask the question, will we see an influx, or will it be like I heard one report after 9/11 where we had a drop in visits where they said, yeah, these people just never came in. We
Mhm.
never, they thought okay, there's a drop and now we're going to have a spike. And they're like, the spike never happened, which to me is almost scarier. But, what do
Right.
you think it's going to be, cost wise for an organization to have this delayed care?
Well, that's interesting, the 9/11 comparison. If you look back at SARS in Taiwan, 2002 to 2004-ish, they saw continued decline in visits during the pandemic. Obviously, people were afraid of contracting the virus. They weren't
Sure.
seeking care. And then if you go actually have data and charts from a report that showed this like line steadily decreasing, followed by a huge spike that was more than at their highest point, which was typically during flu season when they saw the most patients. And these were for things like diabetes, heart failure, stroke, heart attack, like big things that you really don't want to delay care for. So my biggest concern is we saw a 42% decline in ER visits in April this year compared to last year at the same time. And in certain cases, like with stroke or heart attack, those minutes, those half hours, even a day sometimes can be valuable time to do an intervention, get them some treatment and get them back on the path to wellness. Where if they're just not coming in and they're having a mild stroke or a mild heart attack, imagine the devastation and the cost to the health system. Because now you've got really sick patients who haven't been taking care of themselves. You're going to have more inpatient stays. You're going to have a higher cost of medication. You're going to have more screenings now because now you're looking at potentially multi-organ failure, multi-organ, more systems being involved. And it's a situation that's kind of could be spiraling. And unfortunately, we don't have a cost from the Taiwan data. There's no one that came out and said, well, it costs the industry 2.5 billion. But I think it'd be really interesting for this industry to go back after COVID and say, what was that cost of 42% of patients not seeking care in the ER? Where were they going somewhere else? Were they going to primary care? Were they going to Minute Clinic? Because it was in Target and they could go get their Starbucks and go to, where were they going? Or like you said, what's worse is them just not taking care at all.
Yeah, I was going to say it won't show this in the impact numbers, but if they don't go for a heart attack and they just die, well, cryptically saying it, we saved money in the healthcare system, but we also lost someone's life. So, these are challenging issues for sure. I'll give a little glimmer of hope though in this. This is a pretty sad situation, right? But I wonder if all the mask wearing will help with flu season. So I'm interested to see those trends, and maybe that will be a little silver lining on this challenging situation. But let's shift gears for a minute and talk some more about, really what you highlighted, which is how do you communicate with the patients and do that effectively so that they do trust your organization and they are willing to come in. What were some of the lessons you've learned during COVID-19 about tailoring that communication, and what have been some of the results?
Yeah, so the first lesson that I learned is during times of stress or anxiety, err on the side of over communicating instead of under communicating. And it seems so natural. We do this if your family's going through a major transition. I just had a child go from middle school to high school. Like we had a lot of talks about the differences of high school and how you're gonna have to take more responsibility for your own things and how the schedule was different. But we don't really think about that when we're talking about patient-doctor communication. And beyond that, not just patient-doctor communication, but facility, healthcare organization. It's not just up to the doctor to communicate with the patient. It's up to the system or the entity, the organization, to create trust and to create a reason for them to come to you, because you're being attacked from all sides at retail. Walgreens is spinning up, Walmart's spinning up, and now like you said, John, I'm already here buying groceries. Why wouldn't I just go get them to swab my nose and see if I have the flu? So the first lesson is over communicate. The other thing is you have to be really prescriptive with communications. In the beginning, in our VP of strategy, Matt Dixon, says this over and over again, and I think it's really interesting that people don't think about this. They say, come into the office and make sure you social distance. What does that mean?
Right.
Does that mean I don't touch the door handle? Does that mean someone's going to open it for me? Does that mean 6 feet away at all times from everything? What about the counter? What about the chairs? You have to be really prescriptive. So some of the best communications I have seen during this time have been people, and sometimes this text bubble is huge, right? If it's a text message or an email, but they're like, due to COVID procedures, they actually lay it all out. I will come get, or somebody will come get you from the car. Please wait in your car until you're texted to come to the front. Then this will happen. Then this will happen. So this really prescriptive communications of what can I expect? It dissipates fear. It gives me realistic expectations, and it keeps me from just sitting in my car wondering, am I going to be safe when I go in this building? So prescriptive communications is another one that we saw. Another thing that we've seen is with telehealth. Perfect example is telehealth. Don't just assume that people are reluctant to telehealth just because they're in a certain demographic or certain age group. Ask the questions. What are your barriers to telehealth? Maybe do a survey, or what is your willingness to take on telehealth? What visits are right for you to do telehealth? There's enormous willingness right now for patients to try it. My parents in their generation would have never thought of using telehealth, but now they've done a visit because they're in a high risk group, and it made sense for them. But does your patient need extra help or coaching on how to do a telehealth visit? One of the most clever things I saw was taking a group of agents who weren't taking inbound calls because elective procedures had closed, and making outbound calls to patients, coaching them through the telehealth process. Have you downloaded this app? Do you even need an app? Have you tested your link? Do you have the bandwidth appropriate? Is our communication going to be cut off? Because nothing could be more frustrating when you're trying to communicate to a doctor and it's choppy. Am I in the best area in my home? Do I have the privacy I need to have this kind of visit? And these agents were going through all of these questions. And then the patient was like, oh, telehealth's great. This is fantastic, because they took down these barriers to something that was typically scary, and they made it very feasible and very attainable. So, when you're thinking about communications, just be prescriptive, over communicate during times of fear and anxiety. And then, make sure you're asking the questions of your patients. What do they need? Do they need an inbound COVID hotline to say, I'm just freaking out a little bit. My kid just went to school. Someone at school, this actually happened. We got an email yesterday saying someone at school has COVID. So, patients are going to pick up the phone and call and ask a question. Do you have dedicated resources to field those questions, to field the answers, to get them the information that they need to continue about their day?
Yeah, and I see it interestingly across all of your lessons. There's, what I've seen some people, why they haven't done that is they're like, well, I don't want to overwhelm the patient, right? And yet the opposite is what happens, is they overwhelm the patient when they don't share enough information and they don't communicate clearly and over communicate what's needed. Then the patient just spins up in their mind all sorts of crazy scenarios that aren't even realistic. So I think those are some great lessons. You guys do a lot of self-scheduling. What trends have you seen there as well? I think communication's one side, but self-scheduling, we talked about there's been an increase. Are there any lessons you've learned? Because I think a lot of people are scared to do it. Let's just be honest. Like a lot of doctors are like, I don't want to, I'd lose control of my schedule. Like that's, I think, the mentality, right? Which I think is unfair if you do it right. But what are you seeing lesson-wise on online self-scheduling?
Yeah, that's great. That's a really interesting thing, scared to open up their schedules. We hear that actually when people look at using us to answer their phone and schedule through live voice, they're like, our physicians don't want to give up control.
Yeah, same principle.
You have to look at it from the competitive standpoint, though. Why is Minute Clinic taking flu shots and swabbing for flu and COVID right now, and you're not? It's because I can get on there right now and see if they have an appointment available in the next hour. So that's one way to abate that fear, but the fear is real. And what's nice about some scheduling solutions is you can just open up a portion of your schedule. Let's just try for 2 to 4 on Thursdays and Fridays. Let me just leave those open to walk-in visits or online scheduling visits and just see how it goes. I mean, that would be the recommendation I would give, because you might find your increase in patient volume, you might find that your patient acquisition stats go up, and for a marketing person, like that's music to your ears. So I would think the marketing team would be pushing back on the fear side of it and giving them actual stats and how it's able to recruit new patients or find new patients. And with telehealth, the competition is dispersed all over the place, because now you're competing not with Dr. Joe down the street, but with Dr. Joe, in Austin. So there's a lot of competition there. But as far as the pandemic, we've seen scheduling as one of the things that is really talked about a lot, that we see a lot of conversions on, we see a lot of interest in, and I think it's because people are looking at ways to defray the large volumes of people trying to get back into care. They're looking at, how do I get all of these people who need COVID tests in and out of the system efficiently? And it's just a way for people to do risk stratification and get people in very easily without having to use a lot of manpower. It just kind of automates behind the scene. And one thing that's really interesting specifically with our scheduling solution, and our online scheduling solution is a little bit different than some of our competitors, in that in the urgent care space and the ER space, the patient actually picks a projected treatment time. It's different than getting in line, if you will. And what's nice about that for the pandemic is, instead of waiting in a queue, and I've used some of these other solutions before locally, where I go to urgent care, I get in line, they call me, say, head in about 5 minutes, but then I still wait in the waiting room for 20 to 30 minutes until they actually move patients through, and then I can go see a doctor. But with this projected treatment time, I'm picking 3 p.m. today, and I go to that appointment, the resources know I'm coming, they have that room available. And so now we're able to do this virtual waiting room environment where you're waiting at home, or and what's nice about this is, let's say you don't have your own car. Let's talk about the people that have to use rideshare or taxis or a bus or a train to get to the doctor. Virtual waiting room in their car is not an option for them. So what's nice about that projected treatment time is, I can come into the ER, take a train, get there at 3, and the resources know, they're prepared for me. They walk me straight back to the room. I do all my forms virtually, check in online, and it's just made a nicer way for patient throughput in a pandemic time, where you're not sitting in the waiting room and worrying about getting COVID while you're sitting in the waiting room, or you're not worried about, are my patients 6 feet apart, because they're not in your building at that time. And what's really interesting is our scheduling solution runs off of our InQuicker platform, which is our technology that powers the online scheduling. And so we've even seen our customers using marketing with their local TV news outlets, saying, get in quicker and home safer and faster, because you can just drive up. One of our customers has patient parking for InQuicker patients. They have it's like you go to Chick-fil-A and you pick up your Chick-fil-A and you have dedicated curbside parking. They've got like curbside ER dedicated parking resources. And so you just pull into the parking, they come out and get you when they're ready. And then they say, we get you in quicker and home faster. And I have seen that be adopted more in this pandemic than anything I've seen with online scheduling, just because they can market that we are keeping you safe by doing this. We don't want you to avoid the ER. We want you to get the care that you need or the urgent care that you need. Please don't like miss out on your care. Just use this technology and get in quicker and home faster.
Yeah. And I mean, what a great patient experience. I think we all like that. And to me, that's where I think it's going to be interesting to see the virtual waiting room evolve. You know, you highlighted some elements of it, but to me, I look at it and I say, what's the flow from me scheduling an appointment to me checking in for an appointment? And the worst flow is I call in and get a message and you heard my email the wrong way or you got my phone number wrong. And so now I don't get the message, and so then I don't check in, or I don't know that I'm supposed to pull up and wait for you to come out, or whatever the process is. Whereas if I do that all online, I typed the email, I know I did it right, you know, I heard it right. So, you know, it's like, to me, you know, sometimes it's okay to merge the, you know, in person or the phone with the virtual. But, you know, to me, the next generation waiting room is going to need the online self-scheduling and the virtual check-in. You know, what do you see as the features that the waiting room of the future requires? And I guess it's now called digital check-in. Is that the official
Digital
term?
I think we use a lot of terms across the industry, but you know, it's interesting. My daughter's orthodontist uses a virtual waiting room, and it's very manual. You arrive there, I text them, hey, we're here, we're in the parking lot. They text me back and do the COVID screen. You know, have you been out of the country? Have you had any of these symptoms in the last 4 days? And then they come out and get her, take her temperature. I sit in the car. I don't even have to go into the orthodontist, but it's all very manual. They text me a visit summary to my phone afterwards and prompt me to schedule the appointment follow-up. I can see a lot of that manual stuff being handled maybe by AI chatbots in the future. I know some folks are already using this right now, or testing it or piloting it. The challenge there is, if you get this wrong and you damage that patient experience, people are going to be really reluctant to use this. So I can see the chatbots assisting. I can also maybe see video consult from the car or from your ride share as you're on your way. Like, why don't you use my time driving in or riding in and start asking me those COVID screening questions there via a telehealth interface? Or maybe we can do all those questions you asked me when I'm sitting in the doctor's office, those like history questions and everything. Why don't you have that already ready to go so I don't have to spend as much time there? Because, you know, we've seen with COVID that the less interaction, the less time you spend around the virus, the less likely you are to contract it. I can definitely see that, but also providing live wait times and smart routing to destinations based on resource availability, informing providers when you're close and ready that your check-in's complete. Like a new type of automated status board, they already do this with grocery pickup, right? I order my groceries online, I check in on the app when I'm ready to go, or I check in, I'm on my way, and they use my GPS to say, all right, Sarah's really close to being here, we should load her groceries. It's okay if we take them out of the refrigerated section and put them here because she's on her way. And it even tells me, it counts down, estimated arrival 2 minutes. And you know that they're seeing this on that side. I can definitely see this being really useful in a virtual waiting room environment, especially in underserved populations where, are they walking in? You know, you might have to put how you're getting there, or are they using a ride share service to where you're still making the most efficiencies of the patients you do have on site right now, and kind of finagling that appointment time to where it's kind of less of an appointment time and more of an arrival time. And then like if somebody gets there an hour early, you just get them in and get them out, and then the next person you make room for them if you have visibility to everyone that's coming in. It's kind of like reservations at a restaurant, right? If you had full visibility to when those reservations would actually get here, you could maybe get someone and squeeze them in at a table, clear it off before they're ready to use it.
Yeah, I'm just surprised you don't want to answer your allergy question 6 times in your visit. I mean, I can't believe that you don't want that. But you know, the better example actually to what you just said was the DMV tells you where you are in line. It's like we're worse than the DMV when it comes to informing patients where they are in the
And
process.
that's a
So
sad place to be. Like if the DMV can do better, I know a lot of smart people in this industry. I know we can do better than that.
well, and the nice part is that the technology is there now. So, we have this opportunity with COVID-19 and this especially digital check-in to be able to provide that information and also collect the data to be able to know what, how long does a visit take and how long do different visits take and how long do different doctors take to be able to make those estimates. So it's really exciting. Thanks so much, Sarah. I appreciate you sharing the insights. We covered a lot of ground here: communication, self-check-in, all sorts of things. So thanks so much. We've been here with Sarah Bennight from Stericycle Communication Solutions. If you want to find more great content like this, be sure to check it out at healthcareittoday.com. Thanks, Sarah.
Thank you, John.